Right now we are going out to Dr. Brian Licuanan. 1 second here, my phone system. There we go. Dr. Brian Licuanan on Senate Bill 12. You can follow Brian Licuanan at Better Recovery on Twitter. Brian, welcome to the program.
Hey, thank you for having me, Dr. Drew.
So my biggest question here is both the federal and the state governments have made 40 years of attempts at community mental health centers. How is this, and they've mismanaged them horribly, and they've been catastrophic disasters. How is this going to be different?
Well, what we have seen, statistics shows that less than 5% of our health budget has been historically committed to mental health services. And so what Senate Bill number 12 is providing is services to youth, adolescents, and young adults to have immediate access to mental health services. And the reason why that's been a challenge before, for various reasons, whether it be financial support, availability, there has been a real big blockage for people, especially of young age, to have accessibility to services. And so what this is helping is providing a doorway for these young people who are definitely struggling with mental health and in many cases addiction, just more accessibility.
What kind of services will they provide? Do we know yet?
Well, since this is a very new topic as well, I'm gathering information as well, but from what I'm gathering, it's definitely a mental health service in terms of outpatient therapy, individual therapy, perhaps group therapy, and perhaps even addiction services.
Is this going to be paraprofessional? Is it going to be physician managed? What are we looking at here? Because the biggest problem in the previous community mental health centers is they ended up taking low-hanging fruit. People that, they really didn't go after the most ill kids who really needed the help.
Mm-hmm. Well, that is definitely that level of who will be treating these populations. Level of competency has always been a big issue. Yeah. And my hope is that is what we are doing. We are providing training and proper education to these clinicians and providers to help bring family systems on board. As we know, this is a very comprehensive issue, a systemic issue where family systems need to be involved, the individual to be heard. And so from what I'm understanding, it may be a combination of paraprofessionals and licensed professionals.
And do we have any sense that they're going to be coordinated with the schools or anything of that sort?
That is something that is developing as well. And however, coordination with schools is a huge social aspect of getting this comprehensive model and services to some of these children. Because as we know, children and adolescents are at very high risk. 20% of youth ages 13 to 18 actually live with a mental health condition. And so in collaboration with schools and professionals and family, I think, is one of the biggest steps in the right direction.
Well, you say family, but these centers in this region are going to be inundated by foster kids. Inundated.
Sure.
And so I don't know what kind of services they're getting already. So I don't understand how that's going to interface with the many, many, many tens of thousands of foster children we have in the Southern California area.
Absolutely. And that is one of the definitely big issues that we need to address. And I think one of the biggest things to provide accessibility of services is the funding component. And however, what it provides, the big step, I think, Dr. Drew, in the right direction, are we have these youth who feel ashamed and stigmatized and may not have the families that they can speak to give them an opportunity or a safe place to go get treatment, to be heard, to be validated, to steer them in the right direction, and to give them some level of guidance.
Brian Licuanan, thank you so much for joining us. Really appreciate it.
Thank you so much for having me.
You betcha. Dr. Brian Licuanan at Better Recovery is where you can find him.